BCEN Test Prep Exam Answers 2022. Question 1. A patient with a history of atrial fibrillation who is not on anticoagulation presents with acute onset right leg pain, pallor, and absent pulses. The nurse suspects Option A, deep vein thrombosis. Option B, acute arterial occlusion. Option C, cellulitis. Option D, compartment syndrome. The correct answer is option B, acute arterial occlusion. Question 2. Necrotizing fasciitis requires what priority treatment? Option A, broad spectrum antibiotics alone. Option B, immediate surgical debridement. Option C, hyperbaric oxygen therapy. Option D, wound vac placement. The correct answer is option B, immediate surgical debridement. Question 3. The preferred medication for rate control in a patient with atrial fibrillation and rapid ventricular response who has heart failure with reduced ejection fraction is Option A, diltiazem. Option B, verapamil. Option C, metoprolol. Option D, digoxin. The correct answer is option D, digoxin. Stressed about your BCEN exam? We can take BCEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient sustains a laceration and has not had a tetanus vaccine in 12 years. The wound is clean and minor. The nurse should anticipate Option A, no tetanus prophylaxis needed. Option B, a tetanus immunoglobulin only. Option C, Tdap or TD booster. Option D, a tetanus toxoid and tetanus immunoglobulin. The correct answer is option C, Tdap or TD booster. Question 5. A patient with anaphylaxis develops acute respiratory distress, wheezing, and hypotension. What is the priority medication to administer? Option A, albuterol nebulizer. Option B, intravenous diphenhydramine. Option C, intravenous corticosteroids. Option D, intramuscular epinephrine. The correct answer is option D, intramuscular epinephrine. Question 6. A patient leaving against medical advice, AMA, must be informed of Option A, they cannot ever return to this hospital. Option B, their bill will be sent to collections. Option C, the risks and potential consequences of leaving. Option D, the police will be called. The correct answer is option C, the risks and potential consequences of leaving. Question 7. Which of the following is an early, compensatory sign of shock? Option A, anuria. Option B, metabolic acidosis. Option C, tachycardia. Option D, unconsciousness. The correct answer is option C, tachycardia. Question 8. A patient in the emergency department suddenly develops pulseless ventricular tachycardia. The monitor shows a wide complex tachycardia at 220 bpm. What is the priority intervention? Option A, administer amiodarone 300 mg for push. Option B, a synchronized cardioversion at 100 J. Option C, immediate high quality CPR and defibrillation. Option D, a transcutaneous pacing. The correct answer is option C, immediate high quality CPR and defibrillation. Are you looking for BCEN exam actual questions? Visit our website pokerexams.com to access BCEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get BCEN exam answer key today. Question 9. The purpose of administering surfactant to a patient with ARDS is to Option A, bronchodilate the airways. Option B, reduce alveolar surface tension and prevent atelectasis. Option C, decrease pulmonary capillary permeability. Option D, increase mucociliary clearance. The correct answer is option B, reduce alveolar surface tension and prevent atelectasis. Question 10. A patient with a Glasgow Coma Scale score of 8 requires what immediate intervention? Option A, pain medication. Option B, intravenous fluids only. Option C, immediate endotracheal intubation. Option D, a neurological reassessment in 15 minutes. The correct answer is option C, immediate endotracheal intubation. Question 11. In the Emergency Severity Index (ESI) 5- level triage system, a patient who is confused, lethargic, and has a respiratory rate of 8 would be classified as Option A TSI level 1, Option B TSI level 2, Option C TSI level 3, Option D TSI level 4. The correct answer is Option A, ESI level 1. Question 12. After a blow to the nose, a patient develops clear, watery drainage that tests positive for glucose. This indicates Option A bulleric rhinitis, Option B nasal mucosal secretions, Option C CSF leak, rhinorrhea, Option D sinus infection. The correct answer is Option C, CSF leak, rhinorrhea. Question 13. A patient with known cirrhosis presents with massive hematmesis. The nurse suspects bleeding from Option A peptic ulcer, Option B esophageal varices, Option C hemorrhoids, Option D Mallory-Weiss. The correct answer is Option B, esophageal varices. Question 14. In distributive shock, the primary pathophysiology is Option A pump failure, Option B widespread vasodilation and increased capillary permeability, Option C fluid volume loss, Option D obstruction of blood flow. The correct answer is Option B, widespread vasodilation and increased capillary permeability. Question 15. Sudden, painless loss of vision described as a curtain coming down over the eye is a classic presentation of Option A acute glaucoma, Option B retinal detachment, Option C corneal abrasion, Option D cataract. The correct answer is Option B, retinal detachment. Question 16. To calculate cerebral perfusion pressure, CPP, the nurse needs to know Option A heart rate and blood pressure, Option B mean arterial pressure, MAP, and intracranial pressure, ICP, Option C respiratory rate and oxygen saturation, Option D is central venous pressure and cardiac output. The correct answer is Option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Question 17. The initial fluid resuscitation bolus for a patient in septic shock, per surviving sepsis campaign guidelines, is Option A 250 ml of 0.9% normal saline, Option B 500 ml of D5W, Option C at least 30 ml/kg of isotonic crystalloid, Option D packed red blood cells to achieve a hemoglobin of 10 g/dl. The correct answer is Option C, at least 30 ml/kg of isotonic crystalloid. Question 18. Which finding on end-tidal CO2, ETCO2, monitoring indicates successful endotracheal intubation? Option A ETCO2 of 0 mmHg, Option B persistent ETCO2 waveform with each ventilation, Option C PTCO2 of 50 mmHg, Option D a flat line waveform. The correct answer is Option B, persistent ETCO2 waveform with each ventilation. Stressed about your BCEN exam? We can take BCEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. Which laboratory value is most indicative of acute kidney injury? Option A elevated white blood cell count, Option B elevated creatinine and BUN, Option C decreased platelet count, Option D elevated liver enzymes. The correct answer is Option B, elevated creatinine and BUN. Question 20. A trauma patient with significant blood loss is in decompensated hemorrhagic shock. Which finding would the nurse expect to see last, as a very late sign? Option A tachycardia, Option B narrowed pulse pressure, Option C hypotension, Option D tachypnea. The correct answer is Option C, hypotension. Question 21. What is the classic sign of a basilar skull fracture? Option A Battle's sign, mastoid ecchymosis, Option B rhinorrhea with glucose minus negative fluid, Option C hemotympanum, Option D all of the above. The correct answer is option D, all of the above. Question 22. The classic triad of symptoms for a ruptured abdominal aortic aneurysm, AAA, includes option A, hypertension, bradycardia, headache. Option B, abdominal pain, hypotension, and a pulsatile mass. Option C, fever, chills, flank pain. Option D, dysuria, frequency, urgency. The correct answer is option B, abdominal pain, hypotension, and a pulsatile mass. Question 23. A patient presents with sudden onset pleuritic chest pain and shortness of breath. The nurse notes decreased breath sounds on the right, tracheal deviation to the left, and hyperresonance to percussion on the right. The priority intervention is option A, obtain a stat chest X-ray. Option B, a needle decompression at the right second intercostal space. Option C, administer albuterol nebulizer. Option D, prepare for intubation. The correct answer is option B, needle decompression at the right second intercostal space. Question 24. A patient with suspected bowel perforation should have which initial diagnostic study? Option A, CT scan with contrast. Option B, abdominal ultrasound. Option C, upright chest X-ray. Option D, colonoscopy. The correct answer is option C, upright chest X-ray. Question 25. A patient presents with severe epigastric pain radiating to the back, nausea, and vomiting. The nurse notes ecchymosis around the umbilicus. This finding is known as option A, Gray-Turner's sign. Option B, Cullen's sign. Option C, Murphy's sign. Option D, Rovsing's sign. The correct answer is option B, Cullen's sign.